Red Talks Daily International welcomes you this evening to this international webinar session. Good evening. Hope all of you are keeping in good mood and health during this COVID season. Red Talks welcomes you all into this Red Talk fraternity, and we are indeed truly glad to host these webinars. Red Talks Daily International, abbreviated from Research Educational Talks Daily, is promoted by Ratnaprasad Multidisciplinary Research and Educational Society, which is an international renowned research institute since 2012 and is registered with Niti Aayog Government of India, registered under AP State Government Societies Act, registered with MSME Government of India, and recognized and associated with many universities in India and abroad. By working collaboratively with world-class academic portals like with government organizations, universities, reputed colleges, and research institutions for innovative and entrepreneurial spirit, Red Talks, in association with its associated educational bodies, by now have organized more than 200 international gatherings in various academic disciplines, majorly with the participation from academicians, Indian professors, scientists, scholars, and various other countries across the globe. We are privileged to have in our midst an excellent speaker today. In appreciation, we honor the speaker today with the prestigious title Red Talks Speaker. We welcome our speaker now.
Hi everyone, this is Dr. V.V. Manjula Kumari, Senior Physical Therapist and Director at KITES Slimming, Physical Therapy and Cosmetology Clinics, India. Our today's topic is obesity, diabetes and healthy measures. This is my introduction, and I'm also a certified healthcare professional from Harvard Medical School for COVID-19 in people with diabetes or obesity. So, coming to the definition of obesity, obesity can be defined as an excessive amount of body fat which increases the risk of medical illness and premature death. Recently, the World Health Organization proposed guidelines for classifying weight status by body mass index, that is BMI. BMI represents the relationship between weight and height and is calculated as weight divided by height, weight in kgs divided by height in meter square, or as weight in pounds times, that is weight in pounds into 704 divided by height in inches square. The calculation goes like the internationally accepted classification of BMI in adults is as follows. Less than 18.5 BMI is considered as underweight, 18.5 to 24.9 is considered as normal weight, 25 to 29.9 is considered as overweight, 30 to 34.9 is considered as class 1 obesity, 35 to 39.9 is considered as class 2 obesity. Anything more than 40 BMI is considered to be morbid obesity. We have another classification called Asia Pacific classification of BMI, which goes like less than 18.5 is underweight, 18.5 to 22.9 is considered as normal, 23 to 24.9 is considered as overweight, and anything more than 25 is considered as obese. This is according to the Asia Pacific classification of BMI. Coming to the causes of obesity, there are intrinsic as well as extrinsic factors which contribute to obesity, that is, individual factors as well as environmental factors. The individual factors which contribute to obesity are cognition and addiction, genetics and epigenetics, nutrition, hormones and metabolism, exercise and activity levels, sleep, stress, and immunity. All these intrinsic factors contribute to obesity. The extrinsic factors are external factors which contribute to obesity goes like educational system and parenting, workplace and business culture, community and lifestyle planning, food policy and production, healthcare and policy delivery, finances and funding. Obesity and increasing worldwide. WHO has declared it as an epidemic. It's a non-communicable epidemic. Every year, people dying out of obesity and diabetes is more than that dying with COVID-19. This particular non-communicable disease or disorder like obesity and diabetes is more prevalent in developing as well as developed countries. Obesity and overweight contribute to cardiovascular diseases, diabetes, cancer, joint pains, etc. 37% of world adult population that is overweight or obese. Zero number of countries are succeeding in decreasing obesity in the last 33 years. Every year, the obesity cases are going up. 14% of overweight or obese children and adolescents are present worldwide. 62% of world's obese living in developing countries. Coming to diabetes mellitus definition. That is, diabetic mellitus is a metabolic disorder characterized by hyperglycemia due to an absolute or relative lack of insulin or to a cellular response to a cellular resistance to insulin. Major classifications goes like type 1 diabetes and type 2 diabetes. Let us see type 1 versus type 2 diabetes. Type 1 diabetes, previously known as insulin dependent diabetes mellitus, that is IDDM, or juvenile diabetes or childhood diabetes. And type 2 diabetes is known dependent diabetes mellitus, adult onset of diabetes mellitus. There are a lot more classifications available, but this is the major classification which we follow. That is type 1 and type 2 diabetes. So the rate and prevalence of type 1 diabetes is around 5 to 10%. 5 to 10% of all the cases of diabetes are type 1. 90% of all cases of diabetes are type 2. Coming to insulin production, in type 1, none or very little amount of insulin is secreted. In case of type 2, too little or too ineffective insulin. When the cells do not use insulin well, insulin resistance is seen. The age of diagnosis goes like in type 1, usually between the ages 0 to 40. Mostly young children or teens are more prone to this. In case of diabetes mellitus, type 2 diabetes, usually ages 40 plus, mostly adults, but increasingly occurring in children and teens who are overweight and obese. Overweight and obesity contributes to diabetes, and diabetes in turn contributes to overweight and obesity. So it is bidirectional. The relationship between diabetes and obesity is bidirectional one. And the treatment of diabetes goes like type 1 and for type 1 and type 2 type 2 either healthy eating and meal planning, increased physical activity, blood sugar checks, regular checks of blood sugar should be there, and insulin injections are mandatory for type 1 diabetes, and for type 2 diabetes insulin injections may be needed, oral medication may be needed as prescribed by their physician. In type 1 and type 2 diabetes, it goes like in type 1 diabetes, body does not make enough insulin, can develop at any age. Type 1 diabetes known way to prevent it. Nearly 18,000 youth diagnosed each other in 2011 and 2012. In adults, type 1 diabetes accounts for approximately 5% of all diagnosed cases of diabetes. Coming to type 2 diabetes, body can't use insulin properly. This also can develop at any age. Most cases can be prevented. In case of type 2 diabetes in adults, it accounts for approximately 95% of all diagnosed cases of diabetes. More than 5,000 youth diagnosed each year in 2011 and 2012, and the rate is going up. 1.5 million people 18 years and older diagnosed in 2015. The management of type 2 diabetes is as is given by World Health Organization. The risk factors for type 2 diabetes is genetics, age, and family history of diabetes can increase the likelihood of becoming diabetic and cannot be changed. But some behavioral aspects that increases the risk can be altered, like unhealthy diet, which contributes to overweight, 1 in 3, physical inactivity, which contributes to obesity, 1 in 10. What are the key actions for this? For everyone, the key action should be like eat healthy, be physically active, avoid excessive weight gain, check blood glucose. If in doubt, follow medical advice. These are the primary precautions by which we can prevent the risks. These are the avoidable risks. The effects of obesity and diabetes on general health and offering resistance to infections. In other words, how obesity and diabetes makes the body vulnerable to infections or more susceptible to infections. Obesity is now recognized as a chronic or non-communicable disease. Recent researchers have clarified the physiology of weight regulation, the pathophysiology that leads to unwanted weight gain, and maintenance of the obese state, even when reasonable attempts in lifestyle improvement are made. And the adverse health consequences of generalized and central obesity. While more sensitive and specific imaging methods to quantify body composition are available, most office based practitioners will need measure only height, weight, and waist circumference. These are enough. With these, a patient's risks for obesity related comorbidities such as type 2 diabetes mellitus and cardiovascular diseases can be estimated, and appropriate treatment plans and goals can be executed. As COVID 19 is prevailing all over the world, most of the researches are done in COVID 19 aspect, the effects of obesity and diabetes on the occurrence of the severe course of COVID 19 has been done. We take into account these research works to decide the relationship between obesity, diabetes, on our immune system. This is taken as an example. COVID 19 has been taken as an example to explain the effects of obesity and diabetes on our immune system. Obesity, which causes respiratory dysfunction, impaired respiratory mechanisms, increased airway resistance, impaired gaseous exchange, low lung volume, low muscle strength. Obesity associated comorbidities are cardiovascular diseases, diabetes mellitus, kidney diseases, and metabolic risks are hypertension, prediabetes, insulin resistance, dyslipidemia, etc. As said earlier, the more amount of data is available for COVID 19. So, we are going to analyze the COVID 19, but it is a generalized thing that obesity, the effects of obesity on our immune system, which makes us more susceptible to infections. Coming to the early data on COVID 19 and obesity, This is a preliminary research, not of course, it's not peer reviewed as there is no time. Um, this is just a data, so it can be projected like this. The projections are like this. In location Shenzhen, China, those with high BMI were at more than twice the risk of severe pneumonia than when compared to low BMI patients. In China, 88% mortality of 17 COVID patients who died, 15 were either overweight or obese. In Lille, France, 50% of 124 COVID patients had obesity, twice the rate of the comparison group of intensive care patients hospitalized to other reasons last year. Need for mechanical ventilation increased with higher body weight. In Oceania Health, 60% of patients hospitalized with COVID 19 had obesity. Obesity appeared to nearly double their risk of requiring a ventilator. Obesity and COVID 19 severity at Third People's Hospital, Shenzhen, China. Out of 383 COVID 19 patients admitted between January 11th and February 16, 2019, patients with overweight had 86% higher odds of developing severe pneumonia. Patients with obesity showed 2.42-fold higher odds when compared to normal weight. The association appeared more pronounced in men than in women. Clinical characteristics of COVID 19 in New York City. Out of 393 adults of more than 18 years of age with confirmed COVID 19, consequently admitted between March 5th, that is the date of first positive case, and March 27th, 2020, shows like 62.2 years median age, 60.6% male, and out of which 35.8% had obesity. Respiratory failure leading to invasive mechanical ventilation developed in 130 patients, that is 33.1% till date 17/4/2020. 43 have been extubated, 40 have died, 260 discharged, and 93 incomplete outcome data. Obesity, important risk factor for young people. It could be review of data from first 393 COVID-19 patients admitted to New York Presbyterian, Weill Cornell Medical Center, and New York Presbyterian Lower Manhattan Hospital identified obesity as a risk factor for admission. Among adults with more than 54 years old, 50% live with obesity. Though New York obesity rate is 22%. Obesity does turn out to be an important risk factor for young people, and we look at the rest of the United States where obesity rates are higher in New York. That will be of a great concern. We may see a lot more young people being hospitalized, said by Dr. Roy Gulick, Chief of Infectious Diseases, Weill Cornell Medicine. And the association between obesity and more severe disease was not seen in patients over 60 because the age itself is a risk factor for them. The biological basis for obesity and COVID 19 link could be adipocytes populate lung tissue and airways in obese individuals. Are adipocytes a reservoir for SARS or COVID-2? ACE2 upregulated on adipocytes in obesity and diabetes. Cell-mediated immune function is abnormal in chronic obesity, which is the similar concept behind the cancer obesity link. This could be the biological basis for obesity and COVID 19 link, and this could be the same for any infection either. Why is this? Why obesity is associated with all these things? Why obesity is becoming a risk factor? Let us see. Obesity is associated with decreased expiratory reserve volume, functional capacity, and respiratory system compliance. Obesity is associated with the functioning of the lung. So, the respiratory system compliance is a bit compromised. In patients with increased abdominal obesity, pulmonary function is further compromised in supine patients by decreased diaphragmatic exertion, making ventilation more difficult. In this particular patients with abdominal obesity or central obesity, the movement of diaphragm is not that decreased as well, which makes the ventilation more difficult. Increased inflammatory cytokines associated with obesity may contribute to the increased morbidity associated with obesity in COVID-19 infections. This could not only be with the COVID-19 infections, it could be with other infections too, which are respiratory infections. The challenges in management of patients with obesity who became ill and require intensive care, like obesity related conditions, seem to worsen the effect of COVID 19. More difficult to intubate patients with obesity, more challenging to obtain diagnostic imaging as there are weight limits on imaging machines. Patients are more difficult to position and transport by nursing staff, and like pregnant patients in ICUs, they may not do well with the they are prone, that is lying on their tummy. Special beds and positioning transport equipment are available in specialized surgery units only, but may not be widely available elsewhere in hospitals, and certainly not in all countries. Not in all countries like India. Of course, at least in few multi-speciality hospitals, it could be available, but not in all parts of not all parts of our country. Health systems are already not well set up to manage patients with obesity, and the current crisis will expose their limitations even more. Even obesity can contribute to the inflammatory responses in the body, so that makes the condition more worse. To add a gist of this, the effects of obesity on our immune system. Obesity has risen to a top risk factor for COVID-19 severity. Obesity may increase the risk of symptomatic disease in in public and in general infections either. In New York, people under 54 and obesity had higher rates of infection. Obesity appears to greatly reduce the benefit of youth. That is, till date we believed that youth were asymptomatic, but when the youth, when the young people are obese, when the young people are obese, the effects of COVID-19, the symptomatic representation of COVID-19 is more severe. So, obesity appears to greatly reduce the benefit of being young with COVID-19. Coming to the diabetes and risks from COVID-19, people with the diabetes appear to be at increased risk of having a more severe COVID-19 infection, though evidence quantifying the increased risk in certain as highly uncertain. The extent to which the clinical and demographic factors moderate the relationship between diabetes and COVID 19 severity is entirely unclear due to the paucity of data. Yet, it has to be investigated even more. What is already known about this particular subject? We know that diabetes is a frequent comorbidity as well as being a risk factor for poor prognosis in people with COVID 19. What is the key question? What is the precise diabetes related phenotype associated with COVID 19 severity in people with diabetes hospitalized for COVID 19 is going to be the key question. What are the new findings? Coming to the new findings, in people with diabetes hospitalized for COVID 19, the primary outcome, death or tracheal intubation for assisted mechanical ventilation within 7 days of admission, occurred in 29% and death on day 7 in 10.6%, while discharge was possible in 18%. BMI was independently associated with the severity of COVID 19. Primary outcome in the first 7 days following hospital admission in a multivariable analysis. Neither long term glycemic control assessed by HbA1c nor regimen nor routine therapies, including RAS blockers, and DPP4 inhibitors, were associated with COVID 19 severity. Age, microvascular and macrovascular diabetic complications, treated obstructive sleep apnea, dyspnea, and some biological variables, increased AST and CRP, and decreased EGFR and platelet count on admission, were independently associated with the risk of early death in people with diabetes hospitalized in COVID 19. How might this impact on clinical practice in the foreseeable future? We can anticipate certain things, but we are unclear. Special attention should be paid to elderly people with long standing diabetes and advanced diabetic complications who are at risk for fatal COVID 19 and therefore require the strict application of specific management to avoid contamination with the SARS CoV 2. Increased BMI starting in the overweight ranges was an independent prognostic factor for COVID 19 severity, and the link between obesity and COVID 19 deserves further investigation. The particular link is still unclear. It has to be. There are hypotheses which say that there could be some link, and certain studies have even proved that at a detailed investigation is yet to be done to establish the exact link between them so that the outcome can be better. COVID 19 and diabetes clinical implications. Higher prevalence of diabetes in patients with COVID 19 infections. Patients with diabetes have worsened outcome compared to non diabetics. Higher hospital admissions are seen in patients with diabetes. Among hospitalized patients, higher ICU ventilatory support and mortality is seen in patients with diabetes. Inpatient hyperglycemia associated with the poor outcomes. Inpatient management of diabetes target tablet glucose level should not be more than 180 milligrams of deciliter, and insulin therapy is preferred treatment regime, and the target blood glucose level should be maintained between 140 mg per deciliter to 180 milligrams per deciliter. Insulin therapy, it is in ICU continuous insulin infusion, non-ICU basal plus bolus if needed. Follow corticosteroid protocols as per a physician's prescription. Obesity and diabetes definitely have an effect on our immune system. It has been proved at detailed investigations are being done, and detailed studies are being done in this particular field. At we need to establish the exact contributing factors and exact things to be established. So consider so according to the existing data, it is said that obesity and diabetes, they are having their own effect. They are considered to be risk factors for infection as well as in case of COVID-19 prognosis. So we need to keep them at check. Along with diabetes and hypertension, stress is another particular factor. Stress is another contributing factor which has its effects on our body, like stress. Stress contributes to hypertension. Stress contributes to diabetes as well as obesity. The relationship between the interaction between the stress, diabetes mellitus, hypertension as well as the obesity is bidirectional. So it is always advisable to manage your stress. Stress management is much more important to for the healthy lifestyle modification and other things. Healthy measures to improve immunity. The measures which can be taken to improve our immunity goes like, as always, prevention is better than cure. Whatever could be altered, we can alter that, like obesity and other factors which can be altered as soon as if a person is diagnosed to be in overweight, or if the BMI is in overweight, if that particular person tries to control his weight and loses his weight and tries to maintain his normal weight, he can avoid unwanted circumstances like which are prone. He will not be proceeding to obesity range. That is the first thing. If that particular person is unable to lose weight, there are other supporting non-surgical treatments which can help him in losing weight either. So, with all these things, if a person could manage his weight in particular, like a normal weight range, then the diabetes mellitus will be managed as well. With the stress management, the hypertension will also be managed. So, in this way, we can prevent certain unwanted situations. That is what is prevention is better than cure. How about the pre-diabetic condition? What is this pre-diabetes? Pre-diabetes is when a person's blood sugars are higher than normal, but not high enough for that person to be diagnosed with diabetes. So, in this particular person, the sugar levels are relatively higher than normal, but not to that extent that he is diagnosed to be diabetic. What are the common risk factors for prediabetes? It goes like, the chances of getting prediabetes increases after age 45. Men are more likely to get prediabetes than women, and you may have a higher risk if a close family member has diabetes, and your risk increases with the high blood pressure, not getting enough exercise, being overweight or obese can increase your risk of prediabetes. There is a higher risk of prediabetes for Latinos, African Americans, Asians, Indians, American Indians, and Pacific Islanders. Reducing your risk of prediabetes. Exercise at least 150 minutes every week. Eat more fruits and vegetables. Try to lose your weight if you are diagnosed to be in overweight or in obesity range. If your BMI is in the range of obesity or in the range of overweight, try to lose your weight and maintain your BMI at normal weight range. Join a diabetes prevention program which can really help the people. And coming to the healthy lifestyle, as discussed earlier, we need to manage stress, and that in turn helps in managing obesity, managing body weight, which in turn manages the diabetes and also hypertension. What exactly is healthy lifestyle goes like, five areas were chosen because prior studies have shown them to have a large impact on the risk of premature death. Here is how these healthy habits were defined and measured. Healthy diet, which was calculated and rated based on the reported intake of healthy foods like vegetables, fruits, nuts, whole grains, healthy fats, and omega 3 fatty acids, and avoiding unhealthy foods like red and processed meats, sugar sweetened beverages, trans fat, and sodium. High sodium is always injurious to health. So, we need to limit the intake of sodium, that is salt, common salt. Healthy physical activity level, which was measured as at least 30 minutes per day of moderate to vigorous activity daily, must be done. Healthy body weight, defined as a normal body mass index, that is BMI, which is between 18.5 and 24.9. If a particular person is diagnosed to be in overweight range or obesity range, he has to cut down his calories and he has to work out more to come back to his healthy body weight. If that becomes impossible for that particular person, if he cannot do the exercise or if he is unable to lose his weight by normal methods, certain supportive methods, that is non-surgical slimming treatments, are also available, which can be opted for that. Then coming to smoking, well, there is no healthy amount of smoking. There is certainly no healthy amount of smoking. Healthy here meant never having smoked. Moderate alcohol intake, which was measured as between 5 to 15 grams per day for women and 5 to 30 grams per day for men. Generally, one drink contains about 14 grams of pure alcohol, that is 12 ounces of regular beer, 5 ounces of wine, and 1.5 ounces of distilled spirits. Researchers also looked at the data on age, ethnicity, and medication use, as well as comparison data from the National Health and Nutrition Examination Surveys and the Center for Disease Control and Prevention's wide ranging online data for epidemiological research. Based on all this, the healthy lifestyle has been established, and lifestyle modification is the key factor in controlling the non-communicable diseases, in the management of non-communicable diseases like obesity, diabetes, and hypertension. Healthy, happy lifestyle, stress management with uh, yoga, meditation, relaxation techniques. Then coming to the maintaining body weight with obesity management, like eating healthy, exercising for at least 30 minutes an hour. If the person is unable to exercise, opting for the supportive measures, opting for supportive treatments such as non-surgical weight loss methods. Then maintaining diabetes, maintaining blood sugar levels, that is between 140 milligrams per deciliter to 180 milligrams per deciliter, and maintaining the hypertension at 140. I mean, like maintaining the hypertension levels, that is BP levels. All these comes under healthy lifestyle modification. Happy healthy lifestyle modification goes with eating healthy, living healthy, exercising healthy. So life itself is a gift. Living itself is a celebration. Enjoy it. Your body is the reflection of your lifestyle. Stay fit and healthy. Thank you.
Thank you, madam. I take this opportunity to thank Dr. V.V. Manjula Kumari for her informative speech on obesity, diabetes, and healthy measures. Today, the world is suffering with one common major issue. If we have to say, it is nothing but obesity, diabetes. I believe that today Dr. Manjula's talk will make the difference in the audience in the daily habits to fight against obesity and diabetes. Thank you, madam. Once again, we congratulate Dr. V.B. Manjula Kumari for being honored today with the honors title Red Talks Global Speaker. I thank all the virtual audience for participating in this interesting and informative webinar. I request you all to kindly fill the feedback form, which will be open for another 1 hour, that is till 7:30 p.m. today, that is June 3rd, 2020. All the enrolled delegates shall receive the participation certificate in 3 working days. You may ask your doubts in short, if any, in text form as a comment to this video, and we shall be back with answers again in reply to your comment shortly after this talk. www.redtalks.net is our official website. please visit for our upcoming programs. You may also like our Facebook page, facebook.com/Red Talks Daily for Facebook updates. Every Wednesday and Saturday, we have regular talks during 5:30 p.m. and 6:30 p.m. We encourage you to join with us. Kindly subscribe Red Talks by clicking on the subscribe button seen now. Thank you all. Signing off, myself, Dr. Ratnakar, Director, Red Talks.